Good afternoon, everyone. Paul Kelly here in Canberra with the COVID update, and I'm joined today by Lieutenant General Fruin, who will give an update also in relation to the vaccination program. So firstly, obviously everyone is looking at Sydney at the moment, and for the people of Sydney, I just want to really reach out to you and recognise that this is an extremely difficult time and very concerning in terms of the numbers of cases that are being reported, and including those severe cases in intensive care and in hospital. Tragically today, we've had our very first death in Australia from a locally acquired case, a woman in her 90s, I understand, a close contact of other family members. I would stress this was not someone who was in an aged care facility, nor was it someone who had the chance to be vaccinated. So that is a terrible thing for that person, their family, and certainly my condolences to that particular family now. But I think we can see that increase in the cases. There's some concerning signs there about still a large proportion of those over 70 cases today in New South Wales had been in the community whilst infectious. The pleasing part is that the majority of those 77 cases were close contacts of known cases, and the New South Wales authorities are continuing to do an extraordinary job at chasing down those chains of transmission, making sure that they get to those quickly, doing rapid testing, getting those results and taking the action that is required. From the Commonwealth level, we are continuing to meet daily in the Australian Health Protection Principal Committee, that group of Chief Health Officers from around the country and other experts that I chair. We had another meeting today. We've gathered that information from New South Wales, given suggestions as we do, and I'm in very close contact with Dr. Kerry Chant there in New South Wales to give advice and to offer support where that's possible. There's very practical support, of course, that's happening from the Commonwealth in relation to the situation in Sydney, and that includes, because that is a Commonwealth designated hotspot, there is funding available for aged care, for example, in terms of single site worker payments. There is the COVID disaster payment, which is also available now for people that are eligible in Sydney. There is a whole range of other supports that's going into aged care, including our teams doing testing in-reach testing into aged care facilities, as well as offering vaccination to those that may not have taken that up on the first and second round of in-reach vaccination. So that is all happening, and we're continuing to talk closely with the New South Wales authorities about anything else that they might need. So the specific message to Sydney today is the same as you've received from Dr. Chant earlier in terms of what you need to do. This is a time for staying at home. Please do not look for a loophole in what that messaging might be. The message is, unless you have to absolutely leave the house for an essential reason, and they're all listed on the New South Wales website, they've been talked about every day. We've talked about essential reasons for 18 months. Do not leave your home. This virus does not move by itself. It moves with people. And it's when people are mixing that is when the virus spreads. We know that at this moment there are a large number of people with COVID-19 in Sydney. The assumption should be that if you are leaving the house, that you may be the person that has COVID-19. The people that you mix with may be people that have COVID-19. This is a risky time for Sydney. We need to take those messages very clearly and carefully, and that means stay at home unless you absolutely need to go out. The other completely important part of that message is, if you are asked to get a test, get that test as soon as possible. If you have even the most minimal of symptoms, get a test. These are the ways we will be able to chase down those chains of transmission, block them, and stop that spread. The virus does move with people. The third clear message is we can all get COVID-19, and some of us, as we've seen in Sydney in recent days, can get severe illness. So this is not a time for complacency. It's not a time for frustration. It's a time for actually recognising that and taking that responsibility and for yourself, your family and the community. On that basis, there will be a new ad that will be running from advertisement from the Australian government tonight. It's quite graphic. We're only doing this because of the situation in Sydney. It will be running in Sydney. And the messages will be clear. Stay at home, get tested and book in for a vaccination. They're the three messages on that ad. So watch out for that. It is quite graphic and it's meant to be graphic. It is meant to really push that message home that this is important. My final thing before I hand over to General Fruin is in relation to Summit Aged Care in Baulkham Hills. This is where there is an active outbreak in that aged care facility. There is a lot of work that is going on from the Commonwealth in conjunction with New South Wales Health and the local public health unit, as well as Westmead Hospital. There are 6 residents that have been removed from that facility and transferred to hospital for their best care, as well as to protect the residents of that aged care facility. 5 of those 6 were fully vaccinated. Unfortunately, the 6th one was not, and I can report that she is quite unwell at the moment, seriously unwell in hospital. There are some aged care workers that have been involved in that outbreak, but that is under control. It's not spreading through the Summit Aged Care, mostly due to the very high vaccination rate, 2 doses of Pfizer vaccine in that facility, as well as all of the very strong work that's being done with extra workforce, 130 workforce that have come in through the Commonwealth mechanisms, as well as PPE and other infection control procedures.